हेलो दोस्तों, वेलकम बैक टू आवर चैनल नर्स अड्डा। कैसे चल रही है आपकी नर्सिंग ऑफिसर की तैयारी? तो आज से हमारा शुरू हो रहा है ओबीजी का मास्टर सीरीज़, जो कि है वन शॉट में हम कोशिश करेंगे ज़्यादा से ज़्यादा एमसीक्यूज़ कवर करने का। फुल वीडियो में हम टाइम वेस्ट नहीं करेंगे, बस पढ़ाई करेंगे। सो विदाउट वेस्टिंग योर टाइम जस्ट फॉलो द रूल्स। बिना उठे आपको ये पूरा वीडियो देखना है और बस पढ़ाई करना है। हम ये टॉपिक्स इस वीडियो में कवर करने वाले हैं। सो लेट्स स्टार्ट। टॉपिक 1, फीमेल रिप्रोडक्टिव एनाटॉमी एंड फिजियोलॉजी। Question number 1. The normal length of the uterus in an adult nulliparous woman is? Your correct option is option B, 7.5 centimeter. Rationally, the average size of a nulliparous uterus is 7.5, 2.5 centimeter. Next question. Which ligament helps maintain the anteverted position of the uterus? Your correct option is option A, round ligament. Rationally, the round ligament helps keep the uterus in an anteverted position. Question number 3. The normal vaginal pH in women of reproductive age is? Your correct option is option D, 3.8 to 4.5. Rationally, lactobacilli maintain an acidic vaginal pH to prevent infection. Question number 4. The largest part of the uterus is? Your correct option is option B, body or corpus. Question number 5. Fertilization most commonly occurs in the answer already mentioned. The answer is ampulla. Question number 6. Which hormone triggers ovulation? Your correct option is option B, LH. Next question. Which layer of the uterus is shed during menstruation? Your correct option is option A, functional layer of endometrium. Next question. The normal duration of the menstrual cycle is? Your correct option is option C, 21 to 35 days. Next question. The main function of the ovary is? Your correct option is option D, ovum production and hormone secretion. Next question. The strongest support of the uterus is provided by the? Your correct option is option C, cardinal ligament. Next question. The uterine cavity is lined by? Your correct option is option A, simple columnar epithelium. Next question. The ovary is attached to the uterus by the? Your correct option is option C, ovarian ligament. Next question. Which pelvic type is most suitable for normal vaginal delivery? Your correct option is option D, gynecoid. Next question. The corpus luteum mainly secretes? Your correct option is option B, progesterone. Next question. The average weight of a non-pregnant uterus is approximately? Your correct option is option A, 50 to 60 gram. Second topic, female reproductive anatomy and physiology. Question number 16. The external opening of the cervix into the vagina is called? Your correct option is option B, external os. Next question. Which hormone is responsible for the development of secondary sexual characteristics in females? Your correct option is option C, estrogen. Next question, the average length of the fallopian tube is? Your correct option is option D, 10 cm. Next question, the finger-like projections at the end of the fallopian tube are called? Your correct option is option B, fimbriae. Next question, which is the narrowest part of the fallopian tube? Your correct option is option D, interstitial or intramural part. Next question, the ovum survives after ovulation for approximately? Your correct option is option A, 12 to 24 hours. Next question, sperm generally survives in the female reproductive tract for? Your correct option is option C, 3 to 5 days. Next question, which layer of the uterus is responsible for uterine contractions during labor? Your correct option is option C, myometrium. Next question, the outermost layer of the uterus is called? Your correct option is option C, perimetrium. Next question, which part of the uterus lies above the openings of the fallopian tubes? Your correct option is option B, fundus. Question number 26. Ovulation usually occurs on which day of a 28-day menstrual cycle? Your correct option is option C, day 14. Next question, question number 27. Which hormone is secreted by the anterior pituitary to stimulate follicular growth? Your correct option is option B, FSH. Next question, question number 28. The cervical mucus becomes thin and stretchy under the influence of? Your correct option is option D, estrogen. Next question, the functional unit of the ovary is? Your correct option is option B, follicle. Next question, which of the following is the strongest and most important support of the uterus? Your correct option is option A, uterosacral and cardinal ligaments. Next topic, menstrual cycle and hormones. Question number 31. The average duration of the menstrual cycle is? Your correct option is option C, 28 days. Next question, which hormone initiates follicular growth? Your correct option is option B, FSH. Next question, ovulation is triggered by a sudden surge of? Your correct option is option D, LH. Next question, which hormone is mainly secreted during the proliferative phase? Your correct option is option A, estrogen. Next question, which phase follows ovulation? Your correct option is option C, luteal phase. Next question, the corpus luteum mainly secretes? Your correct option is option B, progesterone. Next question, if fertilization does not occur, the corpus luteum degenerates into? Your correct option is option B, corpus albicans. Next question. The first day of menstrual bleeding is considered. Your correct option is option D, day 1. Next question. The normal duration of menstrual bleeding is. Your correct option is option B, 3 to 7 days. Next question. Which hormone is responsible for maintaining pregnancy in the early weeks? Your correct option is option C, progesterone. Next question. Which hormone is known as the milk-producing hormone? Correct option is option C, prolactin. Next question. Oxytocin is secreted from the. Your correct option is option D, posterior pituitary. Next question. Which hormone is detected in pregnancy test? Your correct option is option C, HCG. Next question. Which phase of the uterine cycle corresponds to the luteal phase of the ovarian cycle? Your correct option is option B, secretory phase. Next question. Menstruation occurs mainly due to the withdrawal of. Your correct option is option B, estrogen and progesterone. Next question. The usual site of fertilization is. Your correct option is option B, ampulla of the fallopian tube. Next question. Implantation normally occurs in. Your correct option is option C, upper posterior wall of the uterus. Next question. Implantation usually begins about how many days after the fertilization? Your correct option is option C, 6 to 7 days. Next question. Which cell penetrates the ovum during fertilization? Your correct option is option B, sperm. Next question. The fertilized ovum is called. Your correct option is option C, zygote. Next question. Cleavage of the zygote occurs by. Your correct option is option B, mitosis. Next question. The solid ball of 16 to 32 cells is called. Your correct option is option C, morula. Next question. The fluid-filled stage formed after the morula is. Your correct option is option B, blastocyst. Next question. The outer cell layer of the blastocyst is called. Your correct option is option B, trophoblast. Next question. The inner cell mass of the blastocyst develops into the. Your correct option is option C, embryo. Next question. The placenta is fully formed by approximately. Your correct option is option B, 12 weeks. Next question. Which hormone is first produced by the trophoblast after implantation? Your correct option is option C, HCG. Next question. Which structure connects the fetus to the placenta? Your correct option is option B, umbilical cord. Next question. The normal number of umbilical cord vessels is. Your correct option is option C, 2 arteries and 1 vein. Next one. The embryonic period extends from. Your correct option is option B, 3 to 8 weeks. Next topic, physiological changes in pregnancy. The normal duration of pregnancy is. Correct option is option C, 280 days. Next question, the probable date of delivery EDD is calculated by. Your correct option is option B, Nagel's rule. Next question, which sign is characterized by softening of the lower uterine segment? Your correct option is option C, Hagar's sign. Next question, softening of the cervix in early pregnancy is known as. Your correct option is option C, Goodell's sign. Next question, bluish discoloration of the cervix and vagina is called. Your correct option is option B, Chadwick's sign. Next question, Braxton Hicks contractions are. Your correct option is option B, irregular painless contractions. Next question, the uterus becomes an abdominal organ at approximately how many weeks? Your correct option is option C, 12 weeks. Next question, the fetal heart sound is best heard by a fetoscope after how many weeks? Your correct option is option C, 20 weeks. Next question, quickening is usually felt by a primigravida at how many weeks? Your correct option is option C, 20 weeks. Next question, in a multigravida, quickening is commonly felt at. Your correct option is option B, 16 weeks. Next question, which cardiovascular change normally occurs during pregnancy? Your correct option is option B, increased cardiac output. Next question, physiological anemia in pregnancy is mainly due to. Your correct option is option C, hemodilution. Next one, during pregnancy, the diaphragm is elevated by approximately. Your correct option is option C, 4 cm. Next question, the average maternal weight gain during a normal singleton pregnancy is. Your correct option is option C, 11 to 16 kg. Next question, which of the following is a presumptive sign of pregnancy? Your correct option is option C, quickening. Next important topic is antenatal care or ANC. Next question, the first antenatal visit should ideally occur in how many weeks of pregnancy? Your correct option is option A, before 12 weeks of pregnancy. Next question, which vaccine is routinely recommended during every pregnancy under the current universal immunization program in India? Your correct option is option C, TD, tetanus and diphtheria. Next question, the normal fetal heart rate is. Your correct option is option B, 110 to 160 beats per minute. Next question, the fundal height reaches the level of the umbilicus at approximately how many weeks? Your correct option is option B, 20 weeks. Next question, iron and folic acid supplementation during pregnancy primarily helps to prevent. Your correct option is option B, anemia. Next question, which investigation is used to detect gestational diabetes? Your correct option is option B, OGTT test or oral glucose tolerance test. Next question, during antenatal examination, fetal lie refers to the. Your correct option is option B, relationship of the fetal long axis to the maternal long axis. Next question, which of the following is a danger sign during pregnancy? Your correct option is option C, vaginal bleeding. Next question, the expected maternal weight gain during the first trimester is approximately in how many kg? Your correct option is option A, 0.5 to 2 kg. Next question, which investigation confirms fetal well-being in late pregnancy? Your correct option is option B, non-stress test or NST. Next question, the normal amount of amniotic fluid at term is approximately. Your correct option is option C, 800 to 1 liter. Next question, it is 800 to 1000 ml. Next question, which nutrient is essential to reduce the risk of neutral tube defect? Your correct option is option C, folic acid. Next question, the presenting part in a normal cephalic presentation is. Your correct option is option C, vertex presentation. Next question, which maternal position improves uteroplacental blood flow during late pregnancy? Your correct option is option B, left lateral position. Next question, which of the following is considered a high-risk pregnancy factor? Your correct option is option C, severe anemia. Next important topic is minor disorders of pregnancy. First question, the most common cause of nausea and vomiting in early pregnancy is. Your correct option is option B, increased HCG. Next question, morning sickness is most commonly seen during in which trimester? Your correct option is option A, first trimester. Next question, the best dietary advice for morning sickness is. Your correct option is option C, eat small and frequent meals. Next question, heartburn during pregnancy mainly occurs due to. Your correct option is option B, relaxation of the lower esophageal sphincter by progesterone. Next question, constipation during pregnancy is most commonly due to. Your correct option is option B, progesterone induced decreased bowel motility. Next question, which advice helps prevent constipation in pregnancy? Your correct option is option C, increased fiber and water intake. Next question, backache in pregnancy is mainly due to. Your correct option is option B, postural changes and ligament relaxation. Next question, leg cramps during pregnancy are commonly managed by. Your correct option is option B, massaging and dorsiflexing the foot. Next question, varicose veins in pregnancy occur mainly because of. Your correct option is option A, increased venous pressure. Next question, the most appropriate advice for ankle edema in a normal pregnancy is. Your correct option is option C, elevate the legs and rest in the left lateral position. Next question, which hormone mainly causes the relaxation of smooth muscles during pregnancy? Your correct option is option B, progesterone. Next question, frequency of urination in early pregnancy is mainly due to. Your correct option is option B, pressure of the enlarging uterus on the bladder. Next question, which of the following is a common skin change in pregnancy? Your correct option is option B, melasma or chloasma. Next question, linea nigra develops due to. Your correct option is option B, increased pigmentation during pregnancy. Next question, which of the following minor discomfort is the most common in the third trimester? Your correct option is option B, heartburn. Next important topic is PIH, preeclampsia and eclampsia. PIH is pregnancy induced hypertension. So, moving towards the question, pregnancy induced hypertension develops after. Your correct option is option B, 20 weeks. Next question, the hallmark feature of preeclampsia is. Your correct option is option A, hypertension with proteinuria. Next question, which BP value indicates hypertension in the pregnancy? Your correct option is option C, more than or equal to 140/90 mmHg. Next question, which drug is the drug of choice for preventing and treating eclamptic seizures? Your correct option is option B, magnesium sulfate. Next question, the antidote for magnesium sulfate toxicity is. Your correct option is option B, calcium gluconate. Next question, loss of which reflex is the earliest sign of magnesium sulfate toxicity? Your correct option is option C, deep tendon patellar reflex. Next question, which symptom is considered a warning sign of severe preeclampsia? Your correct option is option B, severe headache. Next question, eclampsia is defined as. Your correct option is option C, preeclampsia with seizures. Next question, proteinuria in preeclampsia is primarily due to damage to the. Your correct option is option B, kidney glomeruli. Next question, which nursing intervention is most appropriate for a woman with severe preeclampsia? Your correct option is option B, maintain a quiet dark room. Next question, which investigation is routinely used to detect proteinuria? Your correct option is option B, urine dipstick test. Next question, which organ is most commonly affected in HELLP syndrome? Correct option is option A, liver. Next question, which fetal complication is commonly associated with preeclampsia? Your correct option is option B, intrauterine growth restriction. Next question, definitive treatment for severe preeclampsia is? Your correct option is option C, delivery of the baby and placenta. Next question, a woman receiving magnesium sulfate should be closely monitored for? Your correct option is option B, deep tendon reflexes, respiratory rate and urine output. Next most important topic is gestational diabetes mellitus, GDM. First question, GDM is defined as glucose intolerance first recognized during? Your correct option is option B, pregnancy. Next question, which hormone contributes most to insulin resistance during pregnancy? Your correct option is option B, HPL or human placental lactogen. Next question, GDM is most commonly screened between? Your correct option is option C, 24 to 28 weeks. Next question, the standard test used to screen for GDM is? Your correct option is option B, OGTT. Next question, the fetus of a mother with uncontrolled GDM is at increased risk of? Your correct option is option B, macrosomia. Next question, the first line management of GDM includes? Your correct option is option B, diet modification and exercise. Next question, if blood glucose remains uncontrolled despite diet and exercise, the preferred medication is? Your correct option is option B, insulin. Next question, which neonatal complication is most commonly seen in infants of diabetic mothers? Your correct option is option B, hypoglycemia. Next question, which maternal complication is more common in women with GDM? Your correct option is option B, preeclampsia. Next question, which fetal complication is associated with maternal diabetes? Your correct option is option D, all of the above. Next question, which investigation helps assess long-term glycemic control? Your correct option is option B, HbA1c. Next question, which organ is primarily responsible for insulin production? Your correct option is option C, pancreas. Next question, which fetal injury is commonly associated with macrosomia during vaginal birth? Your correct option is option C, shoulder dystocia. Next question, women with GDM have an increased future risk of developing? Correct option is option B, type 2 diabetes mellitus. Next question, The best nursing advice for preventing complications of GDM is. Your correct option is option B. Monitor blood glucose regularly and follow diet advice. Next important topic is APH, Antepartum Hemorrhage, Placenta previa and Abruptio placentae. First question under this topic. APH is defined as bleeding from the genital tract after. Your correct option is option D, 28 weeks. Next question. The most common cause of APH is. Your correct option is option A, placenta previa. Next question. Placenta previa means. Your correct option is option B, placenta implanted in the lower uterine segment. Next question. The characteristic bleeding in placenta previa is. Your correct option is option B, painless bright red bleeding. Next question. Abruptio placenta is defined as. Your correct option is option B, premature separation of a normally implanted placenta. Next question. The characteristic symptom of abruptio placenta is. Your correct option is option B, painful bleeding with uterine tenderness. Next question. The uterus in abruptio placenta is usually. Your correct option is option B, tender and rigid. Next question. Which investigation is most useful to confirm placenta previa? Your correct option is option C, ultrasound. Next question. In a woman with suspected placenta previa, which procedure is contraindicated until placental location is confirmed? Your correct option is vaginal examination, option B. Next question. Which fetal complication is common in placenta previa? Your correct option is option B, prematurity. Next question. A major maternal complication of abruptio placenta is. Your correct option is option B, disseminated intravascular coagulation or DIC. Next question. Which condition is more commonly associated with maternal hypertension? Your correct option is option B, abruptio placentae. Next question. Fetal distress is more commonly seen in. Your correct option is option B, abruptio placentae. Next question. Which type of bleeding is classically associated with placenta previa? Your correct option is option B, bright red vaginal bleeding. Next question. Which APH condition is associated with a board-like uterus? Your correct option is option C, abruptio placentae. Next important topic is normal labor. First question. Normal labor is defined as labor occurring between. Your correct option is option C, 37 to 42 weeks. Next question. Which hormone plays the major role in stimulating uterine contractions during labor? Your correct option is option B, oxytocin. Next question, the normal duration of the first stage of labor in a primigravida is approximately. Your correct option is option C, 12 to 14 hours. Next question, the first stage of labor begins with. Your correct option is option B, regular uterine contractions with cervical changes. Next question, the first stage of labor ends with. Your correct option is option B, full cervical dilatation or 10 cm. Next question, full cervical dilatation is. Your correct option is 10 cm, that is option C. Next question, the second stage of labor extends from. Your correct option is option B, full cervical dilatation to delivery of the baby. Next question, the third stage of labor is the period between. Your correct option is option C, birth of the baby and delivery of the placenta. Next question, the fourth stage of labor refers to the first. Your correct option is option C, 2 hours after placental delivery. Next question, the normal duration of the third stage of labor is. Your correct option is option A, up to 30 minutes. Next one, the most common fetal presentation in normal labor is. Your correct option is option C, vertex. Next question, which diameter of the fetal head presents in a well-flexed vertex presentation? Your correct option is option C, suboccipitobregmatic. Next question, which of the following is not one of the 3 P's of labor? Your correct option is option D, pulse. Next one, the primary power responsible for cervical dilatation is. Correct option is option B, uterine contractions. Next question, which cardinal sign confirms the onset of true labor? Your correct option is option B, cervical dilatation with regular contractions. Next question, the main topic is mechanism of labor. It's a very important topic. Next question, the mechanism of labor consists of how many cardinal movements? Your correct option is option C, 7. The first cardinal movement of labor is. Correct option is option B, engagement. Your second cardinal movement is. Correct option is option A, flexion. Next question, during which movement does the fetal occiput rotate anteriorly? Your correct option is option B, internal rotation. Next question, which movement allows the fetal head to pass beneath the pubic symphysis? Your correct option is option B, extension. Next question, restitution occurs immediately after. Your correct option is option C, delivery of the head. Next question, external rotation occurs to align the head with the. Your correct option is option B, shoulders. Next question, which movement is responsible for the final birth of the baby? Your correct option is option C, expulsion. Next question, engagement is said to occur when the. Your correct option is option B, biparietal diameter passes the pelvic inlet. Next question, the prescinding diameter in a well-flexed vertex presentation is. Your correct option is option B, suboccipitobregmatic. Next question, which pelvic diameter is most important for engagement of the fetal head? Your correct option is option B, obstetric conjugate. Next one, the station of the fetal head is assessed in relation to the. Your correct option is option C, ischial spines. Next question, the station 0 indicates that the prescinding part is. Your correct option is option B, at the level of ischial spines. Next question, which cardinal movement occurs after internal rotation? Your correct option is option B, extension. Next question, it's a very important question. The correct sequence of the cardinal movement of labor is. Your correct option is option A, engagement, flexion, descent, internal rotation, extension, restitution, external rotation, and expulsion. Next topic is partograph. A partograph is mainly used to. Your correct option is option B, monitor the progress of labor. Next question, the WHO partograph is started when cervical dilatation reaches. Correct option is option B, 4 cm. Next question, the alert line on the partograph represents cervical dilatation at the rate of. Your correct option is option B, 1 cm per hour. Next question, the action line is drawn. Your correct option is option B, 4 hours to the right of the alert line. Next question, crossing the alert line indicates what? Your correct option is option B, slow progress of labor. Next question, crossing the action line indicates the need for. Your correct option is option B, clinical assessment and intervention. Next question, cervical dilatation on the partograph is marked using. Your correct option is option B, X. Next question, descent of the fetal head is marked using. Correct option is option A, O or 0. Next question, which of the following is not recorded on a partograph? Your correct option is option D, maternal blood group. Next question, Fetal heart rate should normally be. Your correct option is option C, 110 to 160 beats per minute. Next question. Uterine contractions are assessed according to. Your correct option is option B, frequency and duration. Next question. Molding of fetal skull is recorded on the partograph to assess. Your correct option is option B, cephalopelvic disproportion, CPD. Next one. Which maternal parameter is routinely monitored on the partograph? Your correct option is option A, blood pressure. Next question. The main purpose of the partograph is to reduce. Your correct option is option B, prolonged and obstructed labor. Next question. Which parameter is not routinely monitored in the fetal section of the partograph? Your correct option is option D, maternal pulse. Next topic is PPH, postpartum hemorrhage. Postpartum hemorrhage or PPH is defined as blood loss of. Your correct option is option B, more than or equal to 500 ml after vaginal delivery. Next question. Primary PPH occurs within. Your correct option is option C, 24 hours of delivery. Next question. The most common cause of PPH is. Your correct option is option A, uterine atony. Next question. The most common uterotonic drug used to prevent PPH is. Your correct option is option A, oxytocin. Next question. Which is the first nursing action in a woman with uterine atony? Your correct option is option B, uterine massage. Next question. The 4 T's of PPH include all except. Your correct option is thyroid, option D. Next question. The retained placental fragments are classified under which T of PPH? Your correct option is option B, tissue. Next question. Genital tract lacerations causing PPH are classified under. Your correct option is option C, trauma. Next question. Coagulation disorders causing PPH are classified under. Your correct option is option D, thrombin. Next question. Which uterotonic should not be used in women with hypertension? Your correct option is option C, methyl ergometrin or methyl ergonovine. Next question. Tranexamic acid helps control PPH by. Your correct option is option B, preventing breakdown of blood clots. Next question. The best method to prevent PPH is. Your correct option is option B, active management of third stage of labor or AMTSL. Next question. Which sign is an early indicator of hypovolemic shock in PPH? Your correct option is option B, tachycardia. Next question. Which investigation is essential in severe PPH? Your correct option is option A, blood grouping and cross matching. Next question, the most common cause of maternal death due to PPH is? Your correct option is option B, hypovolemic shock. तो इसी के साथ हम वीडियो को एंड करते हैं। मिलते हैं वीडियो के सेकंड पार्ट में। तब तक खुश रहिए, पढ़ाई करते रहिए और मस्त रहिए।